Good day and welcome to another episode of Spotlight, a series brought to you by Canada's largest international media development organization, Journalists for Human Rights, through its program to mobilize media in the fight against COVID-19 or MMFC in partnership with Media Monitoring Africa and Sound Africa. I am JD Ramalapa. This week, we're going to focus on the impact of COVID-19 on the right to health. South Africa is rolling out its national COVID-19 vaccine program, which aims to vaccinate 40 million South Africans. The program entails the procurement, the distribution, and the vaccination monitoring and communicating and mobilizing people to get vaccinated. The rollout will take place in 3 phases and provide vaccination to a minimum of 67% of the population in order to achieve herd immunity. It means that the majority of the population would have to be immune to the virus, and it'll also be indirectly protecting those who are not immune to the virus, and also making sure that the spread of the virus can be managed and contained effectively. Vaccine registration is also now open for people who are over the age of 60 years old. However, there is still a high number of false and misinformation circulating about the vaccine. Today, we'll be joined by Nosiphiwo Mbopa, a journalist with Ngwane FM from Mthatha in the Eastern Cape, who's also part of JHR's MMFC program. We are also very honored to be joined by Reabetsoe Noge, who is the acting council manager for LifeLine Johannesburg, who will give us a general idea of the impact of mental health on local community, on the impact of COVID-19 on mental health in local communities. Welcome to you both. Let me start with you, Nosiphiwo. You are currently working on a story about myths and misinformation around the rollout of the vaccination program in Mthatha. Can you give us a bit of background on what's been going on?
All right, thank you very much, JD. I'll take you through to when the COVID-19 pandemic started and the vaccine rollout. The people here, a lot of skepticism in the public. People are worried that when they heard in the news that the vaccine has side effects, and those something that the side effects might be fatal, and now I'm not going to say they don't want to take the vaccine, but they are a bit skeptical about taking it. So a lot of people are in the rural areas around here. So they are a bit worried about they are a bit interested more in what they hear in the news than the actual vaccine. So when they heard that the vaccine killed people in America and the other parts, but not in South Africa, they say, why should it be tested on them that it could kill people here in South Africa? So they are not willing to take the vaccine. So, and now with the registration process now that's been introduced by the government, that people should register to take the vaccine, ages around 60 and above. The people are not interested in that. I've been to the Department of Health to inquire about the numbers of people that are coming to register for the vaccine, the next rollout of the vaccine to the public. They said there's a very little or few people that comes to the registration centers, but I'm still following that up. So I will report more when I get more information on that.
Okay. Does this mean that
I'm not sure if you can hear me?
No, we can hear you. No. Does this mean that people are not receiving the correct information in communities if you are saying that health authorities in Mthatha are seeing very little numbers of people being registered? What could be the problem? Like, is it data, internet?
I think the people are not informed much about the importance of taking the vaccine, and why they do hear from the news, but there's no one that goes to the areas where they live. I think there should be more education on the vaccine than the registration process coming to the people who are not well informed about the vaccine itself. So now the people are struggling with the fact that the government is giving them a process where they have to register. Some are not even connected to the internet, and some do not even have smartphones. They have to travel to go to the centers. So I think people are ignoring the process because they can't manage to get to the centers where they can register. So if maybe the department could use other means, or maybe organize centers to be based in the places where the people stay, and then they give information about the vaccine itself before even telling them about registering to get vaccinated. I think maybe they lack information on the vaccine itself. And
I'm sorry to interrupt.
Sorry,
You were saying something.
yes. No, yeah, no, you can do you have any other question?
Let me come to you. Let's talk about the impact of COVID-19 on mental health in our community. First of all, where are you based? And as a counselor manager for LifeLine, what sort of requests have you been receiving lately?
Thank you so much, Judy, for this opportunity. So LifeLine is a counseling organization that offers free counseling services to the communities, mainly in Norwood, Alexandra, and Soweto. But we found that with COVID-19, going back to Nosiphiwo, saying that everything started last year in March. And in that sense, people felt like their worlds were turning upside down, because it meant that we needed to live in the new normal, as we call it. And the new normal can be uncomfortable, and it's scary for people, because the impact of COVID-19 is that it's not a thing that we can see with the naked eye. Yes, we can see the impact it's had in terms of the illnesses and the loss of people we've had. But it's also about being scared of something that you cannot see. It's almost like being scared of the boogeyman. You don't know where the boogeyman is, but it's about just the fear of how to keep safe in that space. So it created a lot of changes in the lives of people, because some people lost their jobs because economically our finances couldn't cope. So people lost jobs, people lost loved ones, people lost their sense of stability and balance. They knew that, okay, I go to school, I go to work in the morning, during the day, and now all of a sudden I have to stay in this one room or one place. So it creates that uncomfortable feeling, but also that fear in people is also there in terms of what the world looks like tomorrow, 2 weeks later for them.
So how do we deal with that fear, Reabetsoe? I mean, how do you deal with the feelings of depression, lack of motivation, or even fatigue? What can people do to maybe stabilize this abnormal situation?
I think a model that I like to think of is understanding what is in my control and what is out of my control. So, for example, a global pandemic, it's not something I can just change in a day, or I can tell people to don't go home, don't go to work or school, just stay home. I cannot control that. And it's important to understand the difference that, yes, there's a global pandemic which has had a negative impact, but what can I do, or what can I control? Some of the things I can do is maybe knowing the support systems that are available. Can I talk to a friend? Can I talk to a counselor? Can I talk to a family member or a neighbor if I'm feeling stressed? Somebody that I trust. Other things is being aware of how I'm feeling in that present moment, and actually finding those support networks. So if I'm feeling like overwhelmed, so how can I control that? I'm scared of going outside, or I feel sad that I can't see my friends. Just being aware of the emotions that I am feeling, and at the same time creating those support networks in between to find the support that I need.
LifeLine provides counseling services to local communities. How can people access the services that you provide?
I think the wonderful thing with LifeLine is that we offer a 24-hour service line that a person can just call anytime from wherever part in the country. But what has happened is that our face-to-face has also shifted, and we've had to now have online face-to-face. And we are saying that as much as telephone counseling has the same impact um, for somebody who'd like to receive counseling and emotional support, online counseling can be that gap to, or close a gap rather, in terms of not having face-to-face counseling. So since March last year, we've been offering counseling sessions via WhatsApp. So what people generally do is that they contact us via WhatsApp service to book, and then they will have a WhatsApp video or voice call, or even a Zoom counseling session with one of our counselors. And we've seen the convenience of online counseling because it's convenient. I'm having a session at home instead of actually traveling 2 taxis to go to Lifeline Center at this stage. So to ensure the safety of our clients and our counselors, people can just send a message to our WhatsApp number, which is 065 989 9238. And basically, they can also go onto our website, which is www.lifelinejhb.org.za. And they can also book online. And yes, it's just a great way of also adapting to the changes that are happening, and most importantly, making emotional wellness accessible to everyone.
Did you receive higher volumes than usual since COVID-19, or has the numbers stagnated?
So we are receiving a lot of requests. So for example, we have had up to 60 requests in a day for people feeling distressed and would like to have the opportunity to just speak to somebody who will hear them, and somebody to connect with. Because a lot of the times the emotion that is so evident is feeling alone. It's the fact that I felt alone emotionally while walking around town, but now I actually also feel it deeper because I'm in this one room and I can't interact with people the way I used to. So it's just creating a platform for people to be heard, and to allow people to also exhale some of the stresses they are experiencing. And we have had a lot of intakes whereby in a month we actually counsel about 250 to 300 clients because of the demand that we've received. So we have volunteer counselors who are working with us so beautifully, in the sense that they are making that extra time available to somebody who's 60 and who says in the Eastern Cape, I can't go for this vaccine because I've heard so many things. And it's just about hearing what the client is saying, and support, and just in a way, just being with them emotionally, giving them the support system until they make the final decision of saying, you know what, I think it's just something that I'm scared of. I'll be okay. At the end of the day, it's for my safety. Or whether they decide, actually, I'll just drink all my healthy herbs and not take the vaccine. So it's just about hearing what the client is saying to us, respecting them, but also just hearing them at the end of the day.
Yeah. Nosiphiwo, how has it been for you as a journalist reporting on this COVID-19 pandemic? How have you fared emotionally? How is your mental state? What are some of the obstacles that you were facing in terms of talking to people?
It is a very stressful journey, very stressful, because people don't want to be spoken to, especially about the COVID-19 pandemic, especially if you want a face-to-face. Even with the Department of Health, I've been struggling to get people to speak about the processes that take place amid the pandemic. The people are very scared of coming on a face-to-face meeting with people, so they prefer you speak to them over the phone, but that cannot always be possible in cases where you just need maybe a group of 5 people to address an issue, and then people don't want to come to such meetings. It's been very stressful. I tried to mobilize a few that could speak, but telephonically they could not come to me, and I'm also scared. I'm stressed. I don't want to go and be in contact with people and then end up getting infected by the pandemic as well.
Okay. So, I think I want like a practical resolution to this, because it seems like we need to be talking a lot, but also a lot of people are dealing with many things. A lot of people are stressed. So like, there are a lot of people losing their tempers or just not showing up for things. How would you advise somebody who can't access the services, let's say Reabetsoe, but needs to find some way of coping on their own?
Sorry, I can't hear you.
The question was for Reabetsoe, Nosiphiwo.
Oh,
Okay,
okay.
can you repeat the question just shortly?
I was asking what tools can you give people? So what exercises can they do if they can't reach you, say, over the phone? Because I also remember that you were saying you're receiving a high volume of calls at LifeLine, and it could take someone at least 7 days before they could get an appointment for a counseling session. In the meantime, what other
Okay, so JD, I think the important aspect is there's a challenge with technology, and sometimes WhatsApp doesn't allow us to have like a good connectivity, and we understand that. And I would just encourage people to firstly just try to be aware or be present with how you're feeling. If it's something that you're feeling anxiously here or physically or in the mind, take that thought and be aware of it. And some of the things that people can do is if they're feeling worried or in a panic is breathing exercises. So you can breathe in deeply in and out to just feel safer and contained. Another practical thing that people can do is being aware of the support networks that they do have. Do I have a colleague that I can speak to, or a friend, or a family member, or a neighbor that I actually also trust? So being able to be in that space and knowing that this space creates safety and comfort, that would be the starting step. Because once a person reaches out to even a neighbor who's opposite them, they're able to also engage with more resources that are available. So the local clinic doesn't have a social worker. Is there a Lifeline center at your area? Because we have Lifeline centers around South Africa. So it's just basically finding those support systems and also remembering that you have those inner resources as well, to just be aware of how I'm feeling, and also going back to what is in my control. Am I scared about something that is in my control, or am I scared about something that's out of my control? So that's where I would say people, even Nosiphiwo was saying that she's feeling anxious about going and doing interviews, understanding what is in my control. I have my sanitizer, I have my mask. Those are some of the things, basic things I can do to ensure safety. Um, but at the end of the day, it's just important to understand the difference, and yeah, trusting yourself.
Right. Thank you again. Reabetsoe, can you please repeat the number that people can call both nationally and those who live in Johannesburg and surrounds if they need someone to speak to?
Yes, I think what's wonderful with WhatsApp is that we can have a counseling session with Nosiphiwo in the Eastern Cape while we're here in Johannesburg, or we can have a counseling session with somebody in Limpopo. So people can book on our WhatsApp line, which is 065 989 9238, or visit our website, which is www.lifelinejhb.org.za. Alternatively, as well, they can reach us on the crisis line, which is 011 728 1347, which would also go nationally to different counselors at Lifeline.
All right. Thank you both, Reabetsoe Noge from LifeLine Johannesburg and Nosiphiwo Mbopa from Mthatha for joining us on Spotlight today. Unfortunately, we'll have to leave it here for now. Spotlight is a series of conversations focusing on the impact of COVID-19 on human rights in South Africa. The series is brought to you by Journalists for Human Rights, JHR, in partnership with Media Monitoring Africa and Sound Africa. You can send us an email to info@soundafrica.org for more information, or follow us here on our Facebook page for updates on this and other stories we've covered. Thank you for watching. Until next week, stay safe and sound.
Thank you.